good morning, it's me, Dr. Q, and today we're going to be talking about anal glands in dogs. Not everybody's most favorite subject, but certainly something that makes a lot of dogs very uncomfortable. So we're going to show you what that looks like, and also I'm going to show you a little diagram to start with so you can see what anal glands actually are. They are scent glands that live in little doggies' rectums right about here and here. And so what happens is these fill up with fluid, and when dogs have a nice big wide bowel movement, in theory, as the poop comes through, it pushes on these and empties them out. And so that helps with scent marking for dogs, so they learn a lot of information about each other from that. But sometimes these glands can get plugged up. Different things can cause that. Not enough fiber in the diet is one, and allergies. Sometimes dogs that are prone to allergies will have issues with them getting irritated as well. And the other thing is some conformation. Some dogs are just born with that little tiny pinpoint duct that's in there, that all that fluid has to come out, can be really deep in the body and hard for the fluid to actually push out that little tiny duct. So sometimes we have to get in there and help doggies when they're having problems with that. There's two different ways to do that. One is called the external method, which is what most groomers do. And so they're just going to kind of run their fingers right here on the outside rim of the rectum and try to, generally this duct is going to be more towards the top. So you're going to kind of start down here and squeeze the little bag firmly between your fingers, push it up, and then the fluid will leak out. Careful, sometimes it'll squirt across the room, get in your face. Definitely had that happen more than once or twice. For me, sometimes it's difficult to do both sides with one hand, so I'll put a glove on one hand and do the one side, and a glove on the other hand and do the other side. So just another little tip for you that might be helpful if you're doing them externally. Now, most veterinarians do them internally, which means that we place one finger actually inside the rectum and then grasp the little sac and then pull it and kind of squeeze it to empty it. There's always a risk with doing that, and so generally speaking, it's not recommended for anything but professionals to actually do the in the rectum type of expression of the anal gland, just because there could be, you would hate to be the one that ruptures it if there's a problem in there. They also can have tumors in there and different things, and there's different information that we as vets get depending on what actually comes out of there. If it's chunky or liquid, or maybe it's on the verge, there's blood sometimes if it's on the verge of having an infection, maybe they need some antibiotics. So really appropriate to let your veterinarian do it, the internal expression. But from the outside, that's something that anybody that's brave enough to do it can do it. But let's show you what this looks like in a real life patient. Okay, so I'm always gonna kind of touch him right here and let him know that I'm not gonna do anything that's abrupt or scary or painful. Okay, and then I'm gonna also put the palm of my hand right here, so I'm doing the same thing. I'm gonna kind of touch here so I can get him ready for the idea that we've got some movement happening back here. I'm gonna go ahead and insert very gently. The nice thing is I have little fingers, so it's pretty lucky about that. So I'm going to go in about 1.5 inches. I'm going to have some paper towels here handy. Then you're going to see with my thumb, I'm going to squeeze up like this, very gently. And then right around here somewhere is where we're going to end up getting some fluid coming out. And there it is. So just a little bit. And I'm going to just finish that sort of half moon shape from about 6 o'clock up to 12 o'clock, and that's done. And so there wasn't a lot of fluid in that one, luckily, so that's great. So now we're going to switch to the other side. I'm going to do a little bit more lube for his comfort, since it's not the most fun thing to have to go through for sure. So one more time, and then again, nice and gentle. I'm going to switch my hand around because, again, I'm going to go from about 6 o'clock up to 12 o'clock. And you can't see a thing except for it's running out. And so you got to see a little bit what that looked like. So this one on this side, a little bit more fluid in it than that side. But you can go ahead and let his little tail down. And that's all there is to it, except for a little cleanup on aisle 4, because this smells pretty bad. But otherwise, that's how it goes. And hopefully you don't have to do that very often with doggies. The more often it's physically done for them, the more difficult it is generally for them to empty it themselves. So we want to avoid doing this manual thing as much as possible and add more fiber to the diet preferably, or deal with their underlying allergies so that the body works naturally the way it's supposed to, and we don't have to help them out quite so much. So on that note, I'm Dr. Q, here to help you have the most amazing relationship with all the animals in your life and help their little bottoms feel better too. So thanks for tuning in, and we'll see you right here next time.